And now to officially start our meeting, if you join me with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I now call this the Board of Clermont County Commissioners meeting duly open on April 22nd, 2020. And we'll proceed, since we've had a call to order, we will proceed with the agenda, but I would like to make a change in the agenda real quick. I'm going to move item H up for county and staff elected official discussions. Our Commissioner of Public Health has a standing opening in each one of the commissioner meetings this morning to report on where we are as far as with the COVID-19 virus and our combative efforts. And Julianne Nisbet is on with us this morning. And Julianne, thanks for coming, and the meeting is yours.
Thank you. Good morning, everybody. Just a quick update on our case counts. We currently have 70 confirmed cases in Clermont County, 4 additional probable cases for a total of 74. We've had 20 hospitalizations. 40 of our cases have recovered. We are still at 2 deaths. There was information put out through the state's database yesterday that we were up to 3. It was inaccurate. It was just an issue over address information. We remain at 2 on it. That occasionally occurs when somebody's original address maybe was in Clermont County, but ultimately they were residing outside the county, so the case gets transferred out on it. So that you should actually, hopefully at 2 o'clock when ODH updates their numbers, we'll see that number go away and be back down to 2 for today, which is what we are confirmed at with it. Just a couple things that I would like to make people aware of. So one is we're getting a lot of information from our EMS agencies and kind of hospital that people are not seeking kind of standard medical treatment when they should. And that is a big concern for us. I think there's some fear from the public about calling if they need to for medical issues because they have fear they may be exposed to someone with COVID-19. I really want to assure everyone that our EMS agencies are fantastic. They have protocols for cleaning units between use on it, as well as our hospitals have set up processes where they can triage for different types of issues that are concerning and put people in different areas. So we really do not want people, if they are having issues at home, we don't want them waiting to seek medical treatment. As soon as they would during normal time seek medical treatment, they really need to do that to make sure we're not having some lasting impacts on individuals that we can't then treat properly. So I really do encourage people to continue to seek medical treatment. If it's not something that requires, calling 911 or EMS or going to the emergency department, just reach out to your healthcare provider first and have a conversation with them about whether or not they think you should continue with some of your standard medical appointments. But we really want people to continue to get treatment for other issues, chronic diseases that they may have. The second thing I wanted to update kind of everybody on is the Ohio Department of Health has come out with new software to help us do contact tracing. So standard contact tracing occurs by us manually making phone calls to individuals. The state has come up with some new software that does allow it to be done via text. But I want to talk to people a little bit about it because there's been some issues of hoaxes that are out there with texting. The way the program works is someone would reach out via phone first and talk to an individual, then they actually receive a text from the system if they're agreeable to it, where they can consent to using that system. And really all it does is it texts them a link daily to a website where they can go. It is a protected website, so no one can get the information, where they can just go and put symptoms in or any issues or concerns they're having. If all is good with them, it really requires no response or feedback from us. If they're having issues, then someone will follow back up with them at that point. So that software did launch earlier this week, and we're in the process of kind of using that. It's not perfect. Unfortunately, the majority of close contacts actually normally happen within the same household. And if there are minors where everyone uses one kind of cell phone as their as their number, it won't let us differentiate between the different people. So that's something that we've kind of reported back to the state. We would really like it to have that capability, and we'll see if we're able to do that. But that is a program that we'll be kind of rolling out that should help a little bit to reduce the amount of time and manual effort put into contact tracing. So those are the things I wanted to make you aware of. Unless you guys have questions for me, that's all I have.
Julianne, just one question. Could you just talk a little bit about, obviously people have spent a lot of time at home now. There is obviously a concern throughout Clermont County, not only Clermont County, but through America, about reopening in a phased approach. I know the governor's talked about it. I've heard your response on gating criteria and that kind of thing. Could you just touch on that for the people who are listening?
Sure. I think we're all eagerly waiting to see more of what the governor's plan brings to it. But, as you look at the president's plan and then anything that the governor's coming out with, it is going to be a very slow phased response to kind of opening back up. And while we're all eager to get the economy open, we have to be very careful about, once we open things, we have to wait several weeks to see if there are increases in cases. The way the virus really works, you have, after exposure, it's normally 2 to 14 days before an individual would become symptomatic. So you have to wait through that time frame to really see if it's going to have an impact on increasing cases. We are aware there are a lot of asymptomatic individuals who simply really have no signs or symptoms but carry it. And the biggest concern there is with them bringing it into other facilities, concerns with workers bringing it into congregate care facilities, long-term care nursing home facilities, in other places where we have high-risk individuals. And then, the fact of the matter is those individuals are working in our community every day, and we still want to continue to protect them. So just because some individuals may not become ill or may not have severe cases doesn't mean that we don't have a concern out there, particularly for those individuals that are at higher risk who may have some really severe complications from it. So I think it's gonna be I think the governor is really working to come up with a very detailed plan about how things are going to roll out. And I think they are taking everything into consideration as far as protecting the people. People are gonna have to feel safe. We still receive complaints, mainly from workers that through the stay-at-home order and the essential work and determining that, who are still have concerns that they do not feel safe in their employment. And if people don't feel safe working in those kind of areas, or if customers don't feel comfortable, visiting them because they're not abiding by the social distancing requirements on it, that's going to be a concern, because we're still not going to be able to reopen the economy if people have a lot of those fears as we move forward.
And with you talking about that, I mean, I'm very aware from the occupation, obviously, that I came from, that you can work in a hazardous environment. But for you to be able to do that, you have to be trained and you have to adopt a culture, and that results in that type of protocol. And that's a tough thing to do. Just like you said, probably will come out in phases. People have to see what's available, how you have to respond, what you need to wear, and then be able to adopt that as an acceptable culture that they will, follow those guidelines and employ that each and every day. Thanks so much. Thanks so much, Julianne. No, go ahead. Sorry.
No, I think the only thing I would add to that too is as businesses do start to open up, there's going to be this increased surge for additional PPE. We're still having PPE issues. We still have shortages for healthcare workers. So I think that's another piece of it, that we have to make sure there's the availability for everyone to be able to protect themselves. So we're going to have to keep an eye on the personal protective equipment to make sure our healthcare workers can still have everything they need to do their jobs as the priority.
Testing.
Understood.
Question on testing.
Go ahead.
Question on testing.
Mm-hmm.
Yeah, go ahead.
Can you give us an update, like on testing locations or what the status is?
So we're still struggling with testing locations throughout Ohio on it. And part of the issue is just it's twofold. It's the collection materials and it's the test reagents that are used to be able to do that. Most of the larger healthcare systems have been able to stand up their own labs where they can run those tests kind of in-house, or at least at a facility within their system. So maybe not at every hospital, but at a hospital within their system, where they can run those tests on it. We are aware that the governor has opened back up to send samples to private labs. So you had heard there was a large backlog on the private labs. Quest and LabCorp are the two primary ones on it. They serve the entire nation, so they were being flooded with samples, and it was taking literally 7 up to 10 days for us to get sample results back. And that's a concern during that time frame, to make sure that individuals are properly isolating and then following up on their contacts. So we have received word that those are back open, so that should open up some testing ability, but we are aware that there are still continue to be testing shortages for the materials and the reagents on that. So we received a very, very small supply that came from OSU Medical Center down to us locally that are really designated for some of the congregate care settings. So the long-term care facilities, the jail, where people were in congregate settings on it. And when I say small, I mean, it was a very, very small supply. We were able to give each entity a couple to be able to test. And then we have a small reserve in case we have an outbreak kind of at a facility where, we're working with the state on what their testing guidelines are when that occurs to happen. But we are still aware it's an issue. I'm hoping we'll see more and more open up. I think you're seeing some of the, not necessarily in Ohio yet, but I think other locations where they're working with private businesses, so the Krogers and Walgreens and CVS's and some of those locations to be able to try to open up some testing locations. So I think we will see more in the weeks to come, but it is still definitely a shortage.
Thank you.
Anything else? Julianne, you're doing a great job. I know how stressful a situation like this is to manage. Make sure that you take care of yourself and that you get some time away from it.
Thank you. I appreciate
Welcome.
it.
You bet. Thank you. And in addition, I understand that Karen Shearer is here this morning. Is that
Yes, sir.
correct?
Yes, she wanted to talk to the board about a letter of support for a grant, so I
Okay.
asked her to come to discuss that with the board.
Morning, everyone.
Morning.
I really appreciate the opportunity to talk with you and to get your support for a grant that we are going to be submitting. For everybody, my name is Karen Shearer. I'm the Executive Director of the Mental Health and Recovery Board here in Clermont County. And we are submitting at the end of the week a federal grant to the Department of Justice, which would expand our linkage project in the jail. And commissioners, I believe you're aware of this, but just briefly, we started this program a number of years ago with a grant. The board now funds it. And we have people assigned that can do screening of people in the jail. Those who indicate that they have mental health issues, we can do an assessment. And then they are provided support while in the jail. And then upon release, to make sure they get connected with needed services and that they get the supports and encouragement to stay in services once they're released. And the program has been very effective. We have different paths for different types of the inmates. We look to see if they are currently active clients of our system, and they get, one type of services. There are some who were people in our system, and so they're reconnected. And then the largest pool are people who definitely have issues but have never received mental health treatment before. So what we have been able to accomplish is that many of these individuals upon release do get connected with our system, and we are averaging about 70% of them staying in treatment once they're connected. And I think that is because they make those connections and get engaged while they are in jail, in our local jail, and then have feel more comfortable and feel more engaged in what's going on. Our current program has been focused on mental health issues, but obviously we all know kind of what's been happening on the addiction side in our county and across the country. And a lot of people have been identified as also having addiction issues, but we did not have the staffing and ability to do as much for them as we've been doing for those with mental health issues. So this grant would allow us to expand the linkage program and have staff that, again, would be able to do assessments, work with the individuals while they are still in jail, and get them connected to the kind of services they're going to need when they come out, and then have people meet them and get them connected immediately upon release into services in our system, including medication-assisted treatment. And the hope is that we will greatly reduce recidivism into the jail, but also prevent relapse. And national studies have shown that the most vulnerable time for somebody with an addiction problem to relapse is when they are released from either a residential program or jail. So we are really excited about this program. The collaboration and cooperation with the jail administration has been wonderful. They are incredibly supportive of these services. We did try for a grant for the same thing back in the fall, and we thought we had a really good grant, but of almost 500 applications, we were allowed to be in the 20% to do a grant, a full grant application, and they ended up only giving out 4. So we didn't feel quite as bad about not getting it, but we were all very committed to trying to expand this program. So we have been looking for an opportunity and found this one. I will mention that the jail program right now is suspended because of everything going on with the coronavirus, but we have every expectation it will begin again once the access to the jail issues are lifted. Although we do have one person from Mobile Crisis still in the jail, assisting with screening and helping out jail staff with people who do have these behavioral health issues. So we were able to do that, and the jail was very accommodating. So we have learned that at the federal level, it is very helpful to have elected officials show their support for this this grant, as well as our federal legislators. So we are getting letters from the federal legislators, and we felt that a letter from the county commissioners would be another feather in our cap and maybe help us also get this grant to show that this is really something that the county is committed to, that we really support people and they need treatment, not jail. And we also want to lower the number of people with mental health and addiction services in the jail. So that's kind of where we are. The grant is for 3 years and can be up to $300,000 a year. So for us, that's a lot of money. So I think that's it, unless you have questions.
Karen, I don't believe there are any questions here. Would you say that this particular grant is consistent with the Stepping Up initiative that is throughout our state?
Definitely. Yeah, I would like to mention that Stepping Up is a national endeavor to make sure that people with mental health, and that's a broad definition of mental health to include addiction, either do not get into jail or are connected with services out of the jail. Our county was one of the first to approve it over 5 years ago. So I think Clermont has really been a leader in that arena and has led to a lot of good programs in our system. And as I said, everyone has been so cooperative. We can't thank enough the sheriff's office and jail administration and everybody that works at the jail to really make this an excellent program that we keep evolving and adapting and growing as we go along so that it makes the most sense for everybody involved. So yes, this is definitely part of the Stepping Up initiative.
And Karen,
I learned about Stepping Up 5 years ago when we were at NACO, National Association of County Organizations.
Yes.
Brought it back to Clermont County. So
yes, that was you. We got to go to that presentation, and you were right on board, Ed. I really appreciate that, and the support has been there ever since, and it's done, I think, very good things for our community.
Karen, I for one would be in support of this letter.
I think we should do sometime in our meeting make a motion that we ask Mr. Eigel to write a letter on our behalf.
I'll handle that, Ed, if it's okay with you and Claire.
Yeah, that's fine.
Yes.
I'm just saying it's
Under
fine.
item F.
Yep, very good. Thank you.
Okay, thanks, Karen, for
Thanks, Karen.
being in our meeting today. We appreciate it.
No problem, and again, thank you for your support. It is very much appreciated.
Okay, thank you.
Thank you.
We'll move to B, approval of regular session minutes for April 15th, 2020. Board, I know you've had these minutes in advance of the meeting, had an opportunity to review them or have any questions answered or revisions made. Do I have a motion to approve the regular session minutes of 4/15/2020?
So moved.
I'll second.
It's been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. C, we have 2 proclamations today. The first proclamation is Sexual Assault Awareness Month. And I understand Stephanie is here today to accept this proclamation. Obviously, our social distancing here is 6 feet apart. Little different. Thanks for coming.
Thank you for doing this, as always.
You bet. I have a proclamation here on behalf of the Clermont County Board of Commissioners for Sexual Assault Awareness Month, April 2020. Whereas sexual assault is a violent, intolerable crime that affects every person of Clermont County as a survivor, a family member, significant other, neighbor, co-worker, or friend of a survivor. And whereas rape and sexual assault affect women, children, and men of all races, cultures, and economic backgrounds. Whereas the YWCA Sexual Assault Services Program leads the way in our community, seeking to improve the services for survivors and provide preventative education through a 24-hour hotline, shelter, consulting, support groups, advocacy, professional training and community, and school-based prevention education programs. And whereas we recognize that no person, organization, agency, or community can eliminate sexual assault on their own, we must work together to educate our entire population about what can be done to prevent sexual assault, support survivors and those touched by this violence, and increase the support for agencies providing help to those directly affected by sexual assault. Whereas this community recognizes the vital importance of designating a time devoted to increasing the public's awareness and support of agencies providing services to sexual assault survivors and others directly affected within our community. Now therefore, let it be resolved that we, the Board of Clermont County Commissioners, do hereby proclaim the month of April 2020 as Sexual Assault Awareness Month in Clermont County. Accordingly, all citizens are encouraged to join communities across America in recognizing the role that each of us play in raising our awareness as to how the crime of violence negatively affects every member of our community. And this is on behalf of the Board of Clermont County Commissioners, David L. Painter, President, Edwin H. Humphrey, Vice President, and Claire B. Corcoran, Member. Stephanie, on behalf of the Board of Clermont County Commissioners, thanks for being here this morning to accept this proclamation for Sexual Assault Awareness Month.
Thank you
And the
very
podium
much.
is yours.
Thank you so much. So thank you for having us today. We really, really, really appreciate the support that we received from the Commissioner's Office this year and many other years before that. Just briefly, I just want to say that 63% of sexual assault cases, that includes sexual assault, is a really broad umbrella term for rape, molestation, unwanted sexual contact, sexual harassment, incest, child sexual abuse, sexual exploitation, human trafficking, and voyeurism. And 63% of those are unreported, so that's huge. Every 98 seconds, someone in America is sexually assaulted under that umbrella term. So awareness is crucial to communities so they know that it's going on. And thankfully, with the prosecutor's office, sexual assault is, we don't tolerate it in Clermont County. And we're going to stop it, and we're here to help you. The YWCA has a 24-hour hotline, as Mr. Painter mentioned. It's 753-7281. And we also have protective shelter, and we work in collaboration with sexual assault agencies that can help you further than we can. So call us anytime, get in touch with someone, we'll help you. And thank you for your support every year.
Thank you.
Stephanie, thanks for being here.
Thank you.
You bet. Hi, Stephanie. How are you?
Good morning, how are
The
you?
second Stephanie. That and this morning we have another proclamation for Crime Victims' Rights Week here. Stephanie Ross from Clermont County Prosecutor's Office is here to accept this proclamation. Thanks for being here this morning. Proclamation for National Crime Victims' Rights Week, April 19th through the 25th, 2020. Whereas in 2019, over 2,400 victims of reported crime in Clermont County received services from the Clermont County Prosecutor's Office with the support of the YWCA Little Fork Family Advocacy Center and other local victim service providers. Whereas crime victims have ways to participate meaningfully in the criminal justice system, as demonstrated with the passage of Marsy's Law in 2018. Whereas reaching and serving all victims of crime is essential to supporting communities, we renew our commitment and determination to respond to crime and violence by helping victims find support, recovery, and justice, because those who receive services and support are more likely to remain invested in the criminal justice process. Whereas we use this week to celebrate the accomplishments of our local victim service providers and the crime victim rights movement, all achieved through compassion and collaboration. Whereas National Crime Victims' Rights Week provides an opportunity to ensure that we, as victim service providers, honor the rights of victims and work diligently to secure their trust in the criminal justice and social service systems, and continue to provide appropriate, accessible services. Whereas the Clermont County Prosecutor's Office is dedicated to strengthening victims and survivors in the aftermath of crime, building resilience in our communities and our victim service providers, and bringing hope and healing to all victims and survivors. Now therefore, we, the Board of Clermont County Commissioners, do hereby proclaim the week of April 19th through the 25th, 2020, as National Crime Victims Week in Clermont County, and we ask all citizens of Clermont County to take time to honor crime victims and those who serve them during this week and throughout the year. And it's signed by the Board of Clermont County Commissioners, David L. Painter, President, Edwin H. Humphrey, Vice President, and Claire B. Corcoran, Member. Stephanie, on behalf of the Clermont County Board of Commissioners, please accept this proclamation for Crime Victims' Right Week in Clermont County.
Thank you very much.
Thank you. Podium's yours.
Okay. Thank you. So this year's a little bit different for everybody. Usually this week would be having our annual luncheon that we've had for the last 7 years. So unfortunately we were not able to do that, much to my dismay. However, we're still here today, and thank you for allowing us to be here. So I just wanted to touch on some stuff that our advocates have done the last 6 months. I don't really have much of a comparison, but just to let you, since October 1st, our program has served a total of 1,314 victims of reported crime in our county, with theft being the major crime of that. The second to that becomes domestic violence. The number is for theft is 346 of reported crimes and 336 cases of domestic violence in our county. You know, one thing that is notable to me for our program is our ability to reach out to the public. We do that immediately following a crime. Doesn't matter if it's municipal court, common pleas court, or juvenile court. We do have advocates in every court. The last 6 months, we made a total of over 5,000 notifications of court hearings, and just reaching out, letting people know who we are and what we're able to do for them. So I consider that number very paramount. I think it's a great number for us. So with that, I just like to say thank you for having me here today. And thank you for this proclamation.
Thanks for being
Thanks.
here. You bet. And for all that you do in the prosecutor's office. We
Oh,
appreciate
thank
it.
you.
Thank you. We will go to D, the consent agenda. Board, a consent agenda has been prepared for you. I know you've had it early, had the opportunity to ask any questions or get clarifications. Are there any items that need to be removed from the consent agenda for further discussion or conversation? Okay. And then I'd ask for a motion to approve the consent agenda as presented.
I'll make the motion.
Second?
It's been moved and received a second. Roll call, Judy?
Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Then we will move on to E, the non-consent agenda, which starts on page 5 with item 10. Item 10, it's a recommendation the Board of Clermont County Commissioners adopt resolution number 055-20, resolving to approve payment of vendors in the amount of $1,258,563.61, as set forth in the BCC approval invoice reports for the checks dated April 22nd, 2020, BCC directed prepaid invoice reports, and/or the procurement card transaction report as presented by the county auditor on 4/20/2020, and further authorizing the county auditor to issue warrants for the same pursuant to 319.16 of the Ohio Revised Code. Do I have a motion for approval of item 10 as read?
So moved.
I'll second.
It's been moved and received a second. Roll call, Judy?
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 11. Hi, Pam.
Hi, Pam Havercos, Clermont County Emergency Management Agency. Item number 11 is a recommendation of Pam Havercos, Director of the Clermont County Emergency Management Agency, with concurrence of Thomas J. Eigel, County Administrator, to adopt resolution number 056-20, resolving to adopt the 2020 All Hazard Mitigation Plan for Clermont County, designated as Exhibit A, attached thereto and made a part thereof, which serves as a strategic guide to protect lives and property through the identification of hazards and the development of mitigation strategies in the county of Clermont, pursuant to 44 Code of Federal Regulation, Part 201.3, and to maintain eligibility for future hazard mitigation grant program funding.
Board, you've heard the reading of item number 11 for approval of the 2020 All Hazards Mitigation Plan for Clermont County. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Thanks, Pam. Item number 12.
Morning, I'm Lyle Bloom, Director with the Water Resources Department. And item 12 is a recommendation to adopt resolution number 057-20, resolving to accept approximately 2,594 feet of 24-inch sanitary sewer main serving the Savannah Ridge Subdivision Phase 3 development located in Union Township as part of the county wastewater system, and to authorize payment in the amount of $132,155 to Savannah Ridge 3 LLC out of Independence, Ohio, for the value of the oversizing of said sewer main required by the Clermont County Water Resources Department and contingent upon release of the required purchase order. So this is a situation where the developer needed to extend the sanitary sewer to serve their proposed development. The alignment of that sewer has the potential to serve future development, as well as allow for the future elimination of one of our larger lift stations, which is the East Clough lift station. So we've recommended that they oversize the sanitary sewer from an 8-inch to a 24-inch, and determined that the value for that oversizing is the $132,155, which for us is a great value.
Thanks, Lyle. Board, you've heard the reading of item number 12 for the Savannah Ridge Subdivision Phase 3 development for oversizing the sewer. Do I have a motion for approval?
I move we approve item 12.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 13. Thanks, Lyle.
Morning.
Morning.
Item 13 is a recommendation of Jeremy Evans to accept the following permanent easements granted and conveyed to the county, and this is for roadway purposes necessary for project number MI0919, which is the Level Miamiville Road Bridge replacement that's up in Miami Township, and will authorize payment as compensation for the permanent and the right-of-way granted and repairs relative thereto. We've got two easements, two permanent easements, and one that includes repair to the Fergusons and one to the Rubens.
Thanks, Suki. Board, you've heard the reading of item number 13. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number 14.
Item 14 is a recommendation to execute record plat number 629-3210. This is for the replats of lots in the H.G. Stromenger subdivision. So there's 3 lots that are going to be replatted and combined into one new lot.
Board, you've heard the reading of item number 14. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 15.
Good morning.
Good morning.
Morning, Sandy.
Item 15 is a recommendation of Yvonne Smith, Benefits Coordinator, with concurrence of myself, Sandy Tahat, Human Resource Administrator, to execute the agreement by and between the County of Clermont and Haran Associates on East Galbraith of Cincinnati for the provision of professional consulting services relative to the county's employee benefit programs, as described in the scope of services identified in Exhibit A, attached thereto and made a part thereof, for an amount not to exceed $75,000, effective for the period of June 1st, 2020 through May 31st of 2021, with an option to renew for 2 additional 12-month terms pursuant to the terms and conditions set forth therein, and compliance with Section 3.07.86F of the Ohio Revised Code.
Board, you've heard the reading of item number 15. Do I have a motion for approval?
I'll make the motion.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Sandy, thank you.
Thank you.
Done. That concludes the submitted non-consent agenda, and I will go to item F for additions to the agenda. Do we have any additions to the agenda, Tom?
Yes, sir. Consideration of the letter of support for the Mental Health and Recovery Board's grant submission to the Department of Justice for the Improving Reentry for Adults with Substance Use Disorders Program.
Board, you've heard the recommendation to add amend the agenda to add an add-on for consideration of a motion to cause the administrator to submit a letter for approving reentry of adults for substance abuse disorders program grant submission that Karen Shears talked about us this morning. Do I have a motion to add it to the agenda?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. It has been added to the agenda. Tom, if you just go over it one more time.
Yeah, so this would be a letter of support for the Mental Health and Recovery Board's grant submission to the Department of Justice for the Improving Reentry for Adults with Substance Abuse Disorders Program. And I do have the letter that Karen Scherer provided. It is on our letterhead, and it is available for the commissioners to sign.
And in this letter of recommendation really is an effort to improve the outcome of those individuals with mental health or substance abuse
Yeah,
disorder.
linkages in the jail so they can get into the jail, talk to those individuals, and get them linked up before they leave the jail.
Which is all part of the overall program for the Stepping Up initiative in Ohio to try to properly diagnose those who have codependency requirements and mental health issues and try to divert them from the jail system and or connect them with treatment when they're released. Board, you've heard the request. Do I have a motion for approval of the letter?
I will make that motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Thank you. Any further additions to the agenda?
Yes, sir.
Then I will go to G, executive session. I am requesting an executive session pursuant to section 121.22, G1, and G3 of the Ohio Revised Code to first consider the employment of one or more public employees, and second, to confer with the prosecuting attorney regarding pending or imminent litigation. Do I have a motion to proceed into executive session?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes, we will proceed into executive session. We will return, and we will conduct further business. Thank you. We have returned from executive session. There were no actions or decisions taken, and we will continue on with our agenda. Tom, just one last time, any further additions to the agenda?
Yes, sir.
Then I would go to item H, county staff and elected official discussions. I understand that Mary Raines is here this morning to discuss information about the current budget here at Clermont County. Mary, thanks for being here this morning.
No problem, Commissioner. We really don't have a whole lot of updates as far as the impact to the revenues. I do know that we've received a couple hotel lodging tax payments, but only a couple of them for March yet. So it's really too early to tell the impact on that. One of our bigger ones was down about 60% from February, but really only 36% when you look at an average.
Overall year to date?
Overall, right. So, April's going to take a bigger hit. We just don't know what that's going to be at this point in time. The money that comes here, we pass to us, goes to the Convention and Visitors Bureau. So they're going to be the ones that are really impacted with that. We have the unemployment rates from the Ohio Department of Job and Family Services for March. They have a labor market information division. And we went up to 4.7% unemployment from 4.2 in February. The first quarter comparison really this year is on par with 2018. They're both about 4.5% average. So right now, we haven't seen the big impact, although it is starting to rise. No update on the sales tax. We're still holding around $7 million reduction there as our projection. Casinos, that one's really, I don't know what the governor's going to do about reopening them. We're looking at, based on the first 2 months of this year, actually a $7,500 a day reduction to our revenues. Our budget projection was more closer to $7,000 per day. But if they stay closed through May, we're looking at another $225,000 reduction to our $2.5 million estimate for this year. And that's on top of the $352,000 that we're looking at through May 1st for the 47 days. Recorder's still looking good. I talked to Debbie Klepper, our recorder, yesterday, and she said that with their new system where they bid out, they implemented an e-filing, and actually that was started before the pandemic impact crisis arose. So they're really looking good. She says their recording fees are actually up a little bit, and it's just business as usual, even with the people, because they have both male and female staff, sorry guys. And they're working from home. They're coming in to pick up things a couple days a week, and she said it's really doing well. Building permits are still remaining steady. We will revisit the estimate for that probably when the construction season really starts to pick up this summer in June. They've seen an uptick on residential permits, commercial not so much, but any of the big commercial projects they said are still on track as far as they know. So residential fees don't bring in as much as the commercial, so we may need to cut that back, but we really don't have any idea at this point in time. That's about all I can tell you right now. We're monitoring it, keep looking at anything that the state's sending down, and local government funds will be impacted. They've delayed the filing season for income tax to July 15th, which actually puts that into the state's next fiscal year. Mm-hmm. That's going to have an impact on the local government funds that they.
I know one of the things in the state's OMB report that just came out for this last quarter, one of the things that they noted in there was that it was, we had for those that didn't know, we had a law in 19 there for a while that was overcome pretty quickly. And the performance that is shown in the OMB offsets that lull, but it doesn't take into account, the mid-March reductions because of the COVID-19. So if you look at the report just on its face value, we're actually outperforming, and revenues are higher and costs are lower than compared to last year in 19 at the same time. However, they include that nomenclature on that report that clearly says, based on what we've seen and in that reduction in tax influx, the reduction in gasoline taxes that they projected, that April is where you're really going to see that. But then they warned that in April, you're only going to see that half portion in there from March, that you're not going to catch the full brunt of it until the following month.
Right.
So, yeah.
It's a trickle effect.
I think everybody's kind of looking for that and understanding it. But thanks, Mary, for keeping us, up to date and where we're at.
Do it every week if you need something, if I have it
Okay.
or not.
Yep.
Thank you.
Thank you.
Commissioners, we did receive some good news, and it was in the Sun, the Clermont Sun, but we did get $69,000 from the FAA for airport operations. So
I saw that. I
yeah,
saw that.
so I spoke to the FAA last
That's for
week.
operations?
Yes. Now, we don't operate the airport, as you know, but we do have some operating expenses for the taxiways and the runways, for our crack sealing, our striping, any asphalt repair that we do, and we usually do those almost on an annual basis. So they sent me the application yesterday, so I'll be working through that, and hopefully I can get something to them and to the board to go ahead and apply for those funds as quickly as possible.
And one of the other things on those funds, Tom, I don't know if it would apply or not. Can those funds be used for participatory contributions for other grants that might be applicable to the airport?
The only thing that we talked to them about last week was this airport layout plan, that if we can get funding from the FAA for that, a grant for that, we'd have to provide a match for that. Usually it's 20%, and those are relatively expensive to do. We'd have to hire a consultant to do that.
I just wondered if some of that can be used for match.
We could potentially do that, but it would take a long time to get the funding for that. And right now, we know that we have ongoing maintenance on the runways that we could reimburse our capital for. So we could release some of that capital money if we need to the general fund to cover our lost revenue.
Okay,
Good.
all right. Thank you.
Thank you.
Anything else?
You have anything on CDBG?
A quick update on CDBG, still waiting for guidance from them on what to do. So we're kind of in a holding pattern. I think we're going to see the modified plan coming before you sometime in May.
Okay.
We just don't have it ready yet because CDBG hasn't told us what we can do.
Okay,
So they're the last ones to issue guidance, unfortunately.
Okay.
okay. Anything else?
No, we're still waiting on the FTA funds as well. So we have about $3.8 million, so we're still deciding how we want to apply for those funds, but that should be coming to the board soon as well.
Okay.
And those will be a reimbursement type, so it'll be a drawdown. We'll have
Yeah.
to present, what the monies have been spent for, and then draw that down. So for some of the drivers who have
Yeah,
been,
and the lost revenue and that we'll have for that department. So we'll be able to draw the funds down for that. And we don't have to do it right away.
MOUs with local government agencies.
Yes. All those MOUs to be signed by all the different government
How
agencies.
many have participated?
Yes. Do we have a number on that?
Yeah.
Do we?
I think
Thank you.
8 so far, 8 or 9. And I haven't seen this week's tally yet, but yeah.
Okay.
They haven't been brought to me yet, but I think they will be.
Great. Good question.
Okay. Anything else? Staff here at the dais? Any
No.
comments
Judy?
or questions?
Earth Day.
Oh, yes, it is.
Today is Earth
Earth Day.
Today is Earth Day, you're right. And I'll move to member comments, board members. Ed, any comments today?
Sure, we just need to all do our social distancing and remember that we need to keep into this for quite a while now. It is difficult, but we all need to do it.
Claire, any comments?
Just that, Judy, you're right, it's Earth Day, and I miss being out at Goshen, always did their big celebration with the children outside, and I happened to think of that last night. I thought, well, okay, everybody just go out and keep your distance and walk the park and pick up trash, do what you can do to help out in the meantime.
And I think patience during this COVID-19 thing is a virtue that everyone needs to grasp a hold of. It's obvious that the governor is talking from his news updates every day about phasing, back into an economy, maybe not what we recognized before, but something that is a phased approach to opening businesses within Clermont County. Obviously, the President of the United States and his administration have put out a document called Opening America Again. And in there are some gated requirements for us to move forward. Currently, we don't meet those gated requirements, the gating requirements. I was notified of that from a meeting that the Public Health Department had this past Sunday with Ms. Acton from Columbus, who talked about those gating requirements. And obviously, we need to see a downward trend in COVID-19 cases for us to proceed with considering opening the economy back up here in Clermont County.
We need more testing, better
Yeah.
testing.
Absolutely, and we're all committed to that. You know, we want to get this county back to churn into a great requirement, a great economy as quickly as we can. But by the same token, residents need to understand that, you know, the responsibility is to the safety and security and the health and welfare of those who are here in Clermont County. And we have to approach that very systematically and at a slow pace and ensure that we have the residents' health, best interests in mind, and we plan to do that. So again, you know, ma'am.
And also, Commissioner Painter, in the meantime, hats off to all of our staff who are working outside of their offices, doing a great job, that Clermont County is open. We are not closed. And we are working full force, whether they're here in the office or virtually every day, impacting from their homes and taking care of their children at the same time. And a big thank you from all the commissioners, I would say, for all you're doing to keep things running. Thank you.
Brian Huffner and his group to do all the electronics and the
Yes.
technology and all of that for us, I think, is significant.
Yes.
We will move forward as quickly and as safely as as we are possibly able to do that. So for those who are watching today via electronic media, thanks for tuning in today, and for those who have taken time out of their schedule to show up, although it's very, very limited, we thank them for being here today. With that, I would call a motion to adjourn the meeting.
I'll make that motion.
Second.
It's been moved and received a second. Roll call, Judy?
Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Thank you for being with us today. Watch over your family and your loved ones. We hope you all stay safe. We'll see you at the next meeting. Thank you.